So I'm going to start off and talk about the need that we have here at the Pan Am Clinic Foundation. So musculoskeletal conditions actually make up the second greatest cause of disability worldwide and is the fourth greatest impact on overall health. And it actually results in chronic pain or disability in 1 in 8 Canadians. And so this affects every single person in this room, either directly or indirectly. And I think that's why there's such a great showing and such great support for the foundation here in Winnipeg. Now, the mission statement of the foundation is that the foundation will raise funds to help attract the people and offer the programs to create and maintain a world-class research, education, and healthcare organization for Manitoba and beyond. Now, these numbers are actually quite staggering. 228,000 patient visits at the Pan Am Clinic every year. Over 70,000 people go through sports medicine. 3,600 orthopedic surgeries, nearly 10,000 MRIs, and over 50,000 X-rays. And the only reason that this is possible is because there's an incredible culture at Pan Am Clinic. People work together, very efficient, they collaborate, great teamwork, and to get all this throughput in 365 days is actually incredible. Now, I want to take the opportunity to talk about some of the programs that are being offered and funded through the foundation. Our surgical team consists of 8 surgeons right now. I'm going to begin by talking about the research program that is being run at the foundation. So there's basically 2 primary research branches. The first is the orthopedic surgery and rehabilitation branch, and the second is the concussion and sports science branch. Now, the research program has secured over $1.15 million in research grants over and above the capital startup. In addition, there's been over 200 peer-reviewed publications and over 60 ongoing clinical trials with over 1,400 patients currently enrolled. Now, this is only possible because there's a strong leadership and strong team that's working around the clock. We have PhDs, master's students, PTs, and everybody working tirelessly to be able to put through this many patients and this many studies. The concussion group actually has had a significant regional and global impact affecting children, recreational and professional athletes, and they've actually had some groundbreaking outcomes where they've shown that mild physical activity actually is beneficial to patients following concussion, contrary to the current concussion guidelines around the world, and they're currently evaluating how to use aerobic exercise to diagnose and treat concussions. We're basically using the research that we have right now to create evidence-based treatment guidelines that we're then initiating in our clinics. And then with this, we're identifying new questions and then creating new research projects. And this basically creates a cycle where we're able to provide world-leading care to our patients every day. When we look at the last 5 years specifically, there's been over 80 research publications go through the foundation. And this has allowed for global collaboration with some of the biggest institutions around the world. Your support has made many of these projects possible. We've been able to secure a surgical simulation, which is basically like a flight simulator of the human body. This provides enhanced orthopedic training. This has been used for several studies as well as for a master's project. And we also used the funding to purchase an ultrasound that's been used to improve diagnosis of conditions in the shoulder clinic and then evaluate its effect on reducing the burden on MRI, shortening wait lists, and improving patient care. A couple other things that are just getting started is we just launched the registry that we're using for evaluating quality control. We initiated this looking at ACL and rotator cuff registry, and this allows us to have immediate access to patient care and information so that we can improve outcome and support resource allocation. And I'm just going to talk about a few quick examples of that. So the first is we can basically pull 2 different treatments for the same condition. And even though these look like they're providing the same results and we're seeing these patients early in the clinic, we're now able to follow these patients long term and identify that one of these treatments is in fact better and then offer that preferentially over the other treatment. The other advantage that the registry has is that we can look at this data, and when a patient comes in, we can use this for patient education. So if somebody comes in and says they have a shoulder that has 8 out of 10 pain and they ask, well, how effective will this surgery be for me? We can now tell them that their shoulder may be 8 out of 10 pain today, but by 6 months we expect that to be down to 4 out of 10 pain, or 2 out of 10 pain, and then by 2 years, 1 out of 10 pain. I think this is really tangible information for patients, and it really makes the surgical decision-making process from their end a lot easier. We also are very focused on education. So Pan Am Clinic has actually been involved in the teaching of 53 fully trained orthopedic surgeons that are now practicing all over the world, increasing the footprint that the Pan Am Clinic has worldwide. And there's also been 12 sports medicine fellows that have trained here that are now fully trained working around the world. So a significant number of people that are now working all over the world that trained here, and it just makes a huge impact. The Pan Am Clinic has also put on 14 annual surgical skills courses, the last of which was a couple of weeks ago and was a huge success. You can see with Dr. Pete McDonald there, we had 2 visiting surgeons, one from Toronto and one from Vancouver. And in previous years, there's been people come over from Europe and across the United States. And then I think the thing that people at the Pan Am Clinic are most proud of is the community outreach programs. And these are designed to try to increase awareness of healthcare and get more people into either nursing, PT, physicians. And what we're trying to do is motivate the youth of today to become the caregivers of tomorrow so that we can improve the health for everyone. A few specific examples of this are shown here, and this is the Medical Careers Exploration Program. And this is offered to inner city youth here in Winnipeg. It's been going on for 12 years now, and there's been over 50 graduates from this program. This is another program that's being, Dr. John Marsh has been heading, and this is 20 educational live surgeries have been performed, and these get projected out to communities around Winnipeg. So children get to watch, children and high school students get to watch these surgeries. The surgeon is hooked up to a microphone, and we have live cameras in the OR, and then they can actually ask questions to the surgeon live while this is happening, or they can text questions in if they're a little bit more nervous, and then the surgeon actually answers those questions while they're doing that. So that's been a huge success as well, so a hand for that as well. Another one of the things that has been a huge success is the patient education programs. So this is looking at pre and post-operative education where people can come for sessions and get an idea of what the surgery will entail, what they expect the recovery to be, and this has been really positive feedback from patients on this respect. And all of these things that I talked about today are obviously not possible without the support of all the people in the room, and there's also some very generous donors. So I'd like to specifically thank David and Ruth Asper for their generous contributions to the Surgical Skills Lab. We also have had significant contributions from Mr. Albrechtsen with the research chair that's been funded for the last 10 years, and he's made another generous donation, bringing his total support up to $1.5 million. So finally, I'd just like to thank everybody in the room one last time. This is an incredible venue, incredible event. Thank you so much to every single person who's come out here today. We really appreciate your support in helping us run this team, and we certainly want to keep the momentum going in the future. Thank you.